Hi, good afternoon, everyone. A very warm welcome to all of you for today's session. I'm Anvesha Pandey, Senior Director at Nat Health, and I'm excited to have you all for this session. Nat Health has been organizing such type of sessions on various topics, but today's topic is very special because today we are going to cover human resource readiness for the healthcare growth. As we are all aware that like any other sector, healthcare sector is also experiencing a significant growth, which is actually driven by a technological advancement in medical sciences. And for that, this growth actually necessitates a very well prepared workforce to meet the evolving needs of the healthcare sector. So today we are going to explore this depth with our eminent speaker, Mr. Rajneesh Singh. Mr. Rajneesh is the CEO of the Simpli Group, bringing over 3 decades of experiences both as an HR practitioner and as an entrepreneur. In his corporate career, he has served organizations like Gillette and the Networks 18 Group. In January 2011, he actually founded Simpli HR Solutions, which has evolved into Simpli Group, which actually focuses on HR tech and human resource services. Rajneesh is also, he actually mentors the budding entrepreneurs and is actively engaged in various non-government organizations. He's also published a lot of books, and including the one which actually talks about his fight against cancer. So a very warm welcome to you, Rajneesh. Thank you for joining us for today's session. How are you today?
Thank you, Anvesha. Thank you for the warm welcome. Absolutely delighted to be on this show with you. Very, very relevant topic, and one has been witnessing the exponential growth in the healthcare sector, especially after COVID. So naturally, because the healthcare sector is so much about people, both behind and in front. I mean, you've got patients on the other side, and then you've got the medical fraternity on the other side. Very clearly, there has to be a tremendous focus on how the whole people management is being, from a strategy standpoint, from implementation standpoint, all that matters a lot. And that is where, as Simply Group, we are really happy to be here, and I would be really delighted and happy to be sharing my thoughts with you.
Wonderful, wonderful. So let's start with few questions that have been floating in, some of, very relevant on the areas that you covered, or we will be going to talk about. So what are the HR strategies in the healthcare organizations should adopt to manage this increasing demand for the healthcare services? How do you think the CEOs of the organizations or the CXO should be able to manage the talent effectively? Or recruit them, and most importantly, how do you think they are going to retain them and train them? So would you like to throw some light on this?
Yeah, thank you, Anusha. Very, very important question. And I guess the whole story of HR anywhere starts with talent. So very clearly, the way I see the healthcare sector right now, you've got two sets of people. There are established players. So there are large organizations who've been there, who have very much set people practices in place. But at the same time, there are new players coming into the field, and which is a welcome move, I would say. A lot of people really getting to understand how we are so ill prepared from a healthcare standpoint, from a pure scale standpoint, going by the population that we have. And so therefore, the HR strategy would really differ for both the type of organizations. One is how the established organizations need to handle this exponential growth, and how the startups need to handle. So there are two ways to really look at the whole HR strategy. For the established players, very clearly, they'll become the poaching ground for the startups, because naturally the startups are going to look up to trained professionals to be poached from the established organizations. So which means that for the established companies or organizations, it becomes very important how you are kind of holding on to your talent, whether they are doctors or whether they are paramedical staff. It could be anybody down the chain, and so everybody will be up to be poached. So that's the bad news for the established companies. And so for them, the HR strategy has to be all around talent, how to really compensate your current talent, how you're building a kind of a long-term engagement with your talent right now. Are you being very agile with certain policies? I think that becomes very, very important. So for the established players, very clearly, you can't be just sitting on your laurels that, you've been running, you've been growing this far, but that will kind of continue to be as is. I mean, that's going to be challenged. So which is good because then that puts the established players also on notice in a way that you got to really up your game. You got to be really taking care of your people whom probably you might have taken for granted that they will not go anywhere. But with the changing times, you never know. So that is for the established strategy, for the established organizations. On the other hand, for the startup, hospitals or anybody getting into healthcare, I think the strategy has to be very, very clearly the kind of culture that you're going to bring in, the kind of values that you're going to put in place becomes very important. The kind of policies and practices and processes that you're going to bring in around HR becomes very important. Are you being seen as a player who are very, very serious about a very long-term stay in the game? That becomes important because anybody joining you would want to definitely be absolutely confident that they're joining a bunch of people who are going to be there for the long run. I think that becomes very important. It also very, very clearly, from a talent attraction standpoint for any startup in any industry, I think creating a very powerful employer brand becomes very important from an HR strategy standpoint. So the creating a very kind of a attractive employer brand is very essential. And the ingredients could be very, which we can talk later about it. But yes, the essence has to be how you're making your visibility there in the market so that people really get attracted and they're looking to join you. So those are some of my opening thoughts on both sets of organizations and how the HR strategy is going to be differing for both the type of organizations.
Very well said. So that's very interesting. So do you think that when a growing organization like a startup, do you think that they how would they strategize, because they may not be able to invest so much in say human resources? It's mainly going to be recruiting and probably certain amount of training, but the amount of resources which a larger organizations can lend on training or say overall development of the employees is going to be much more. So how do you think the smaller organizations are going to maintain or retain their staff? How is that possible?
So like I said, very, very important, how you are being seen in the market becomes very important. And in today's context, when I was talking about employer brand, I guess in the healthcare sector, it becomes very important. It starts right from the top, the kind of doctors who have kind of started the organization will matter a lot. Because there is a huge credibility that goes around the set of people who are the founders of such a startup. So even before the employer brand, I think somewhere the personal brand of these set of founders who are coming into the game becomes a very interesting pull for any talent. I think the story starts there, and that once the personal brand is established, and one expects that because naturally in this area of work, experience matters. And so obviously, if experienced doctors are coming together, they're starting something of their own. So from a shift from a personal brand to an employer brand becomes very, very essential. And so for the founders, it is important to realize that it's not only about my personal brand, but it is also about, if you are in the business of creating an organization, everything matters beyond you, and which means that you've got to have processes in place, you've got to have systems in place, and you've got to have very clear-cut policies in place. And at a very high level, the kind of culture that you're building, because that culture is the sticky factor, which is where people stay with a company for a long run.
Yeah. So that's very interesting observation. Let me shift it slightly, and let me ask you a slightly different question. With so much of technological advancement, and the growing needs in healthcare. We have seen AI evolution. We have seen so much evolution in the technological space. So how do you think, these healthcare organizations can forecast the human resource needs, and how do you think they can plan with the future needs of the organization, the future workforce needs of the organization?
Absolutely. I mean, like you mentioned right at the beginning of the show also that, there's been so much of technological advancement in the medical field, and that's where the exponential growth is happening. Similarly, on the people side, also there has been technology which is coming in a big way. And not only in people, I would say any other aspect of a business, there's huge leveraging of technology which is happening across functions, across disciplines. So it goes without saying that HR also has definitely benefited from the technology that has come in. We as an organization, like you mentioned during the introduction also, that we've also invested in technology, and we are now going really big into tech because we believe if scale has to be managed, I think tech is the only solution that you will have. Otherwise, it's so difficult that if you want to do things manually, do it in a very individual capacity, there's that you can grow. But the moment you bring in technology, naturally a scale is guaranteed. Now, how you really handle that technology becomes important. I think when you talk about forecasting with the presence of data analytics, the kind of tools that you have today, with the presence of AI also, it is becoming relatively easier to really predict or forecast what kind of, and how many workforce one could be requiring. And that would largely depend on how you're mapping your current manpower, who are going to stay in the company, can be tracked, can be monitored. So that helps you in planning for the future, right? Based on the growth that you're seeing, and especially for a startup hospital or an organization, could be that if there is certain vertical which is really growing, can it be forecasted that in so many years, so many people will be required of this caliber? I think those are the things those are becoming very, very relatively easier now. So it is all about mining a lot of data, and definitely by using technology. And that is where most of the large big tech companies operate like that. And they're very agile. I think the word I would use in really workforce management, workforce planning, workforce forecasting is how agile you are. So it is very, very important for, you could be in a business in this sector, could be actually not seeing growth. Now there also, how quickly you are ramping down rather than ramping up would be important. And at the same time, on the other side, if you are witnessing growth, it will be so very important that you are getting prepared for the future. So that future readiness becomes very important. And that is where a lot of data, analytics, and technology will go very hand in hand.
Yeah. So do you have any advice? Like, what are the best tools for, ensuring this human resources processes, and, which tools are more effective? I think when we were, growing, or in our earlier careers, there was like big five personality traits, answer a couple of questions, and then I'm sure a lot of things have evolved in this space also. So what are the best technological tools that you think are the best for the organizations can utilize to manage their human resources?
So I think, look, one is at a very base level, there are various HRMS softwares today through which you really manage your transactional stuff, which typically gives you enough comfort in running your day-to-day operations. So which could be very basic elementary stuff from how you're onboarding people and how leave attendance, payroll, etc. is being managed. In all the HR softwares that you have today, things are getting upped. The advancement is happening in that, and so you could see many players in the tech space, and there are many out there where especially on the performance, and everybody's today talking about having a lot of intelligence around performance management, because that is becoming very critical. And so when we are talking about talent, everybody is becoming very mindful whether this talent is going to work for me or not going to work for me. So there are tools now available in literally every software where you are able to kind of, understand, realize, and also manage the talent that's going to work and not going to work. And accordingly, then you plan. And so whether you want to kind of give opportunities for somebody to really shape up and probably decide to move on, or probably really reward also. So there are these multiple strategies that will happen. And there are, like I said, there are multiple tools out there. One could be using softwares which are out there. One could be using. So enough and plenty in the market, and Risha, right now, it's just about putting your minds together, HR teams just scanning the market and really finding out which are the right softwares and the tools to really take things forward. And like I said at the beginning, there are many companies who are purely into data analytics. And those are the companies, again, to tap to really bring in softwares which just focus on data. And that data could be just not about HR. It could be data about anything in the organization.
So yeah, I think with technology, with growing technology, we can utilize it in so many ways. So that's very well said. So, if I have to ask another question, so what, in your opinion, are the best practices for onboarding, training, and retaining our healthcare employees so that, they are well prepared and they are aligned with organization goals?
So I think, again, a very interesting question. And I'll go back to the way I responded to the first question, where there are established players and then there are startups. And so in best practices, I think it's no more one size fits all. So you just can't have HR practices or policies which you think you're going to just apply to everybody. Doesn't work like that, which means that certain policies are going to be very much aligned for a set of people. So a certain type of processes will be helping a certain set of people. So my sense would be that if one way to really design kind of practices for an organization, a lot of things one could be doing very differently for, say, for the doctor community in the organization. One could be doing very different thing for the nursing community, for example, and one could be doing very, very different for the support people in the organization. So overall, if you look at it, the way I would onboard, probably my onboarding could be very common because that's a very important first point for any organization. So yes, at that point level, would I give all possible comfort to anybody joining my organization? Absolutely, I would like to do that. Showcase my best so that everybody gets that first impression right. That's very, very important. But then please understand the onboarding has started right from the moment you've actually reached out to a candidate, right? So those experiences start at the moment you have called somebody for an interview, right? And so the experience becomes very critical. And today everybody is talking about that whole experience factor, and that becomes very important. So when we are designing HR practices in organizations, we will have to be very mindful. What works for doctors may not really work for nursing community. What works for nursing community may not work for the support community. So I think you will have to have diversity in place, be very, very sensitive on the needs and expectations of these communities becomes very important. So that's where probably my hiring strategy for, say, for example, a doctors community going to the MBBS schools, colleges, doing a very deeper campus connect matters a lot. At the same time, I could be reaching out to these nursing schools, building a huge connect with those schools also becomes very important. So I'm just talking right now about the entire strategy from a talent attraction. Forget about going to job portals and different other recruitment sources. At the same time, when we are talking about retention, I think that also needs to differ from people to people. I think we see a lot of churn happening at the lower down the level. Now, how do you manage that churn becomes very important. So the readiness around managing the churn, around paramedical staff, the nursing community, that's a population that you need to be really, really ready to be managing, because that's a constant role that is happening. I think the key is how the doctors also are thinking like CEOs becomes very important. Are thinking like HR people becomes very important, because end of the day, the entire team is working with them. And so for a person heading a department in a hospital, in a healthcare organization becomes very important. So it's not about just the medical science part of it. I think they have to widen their horizon, and that is where importance of HR will become very, very critical, because the way the market is opening up, the kind of opportunities that are coming up, retention will be up top of the agenda for any HOD in any healthcare organization. And there has to be multiple strategies that one needs to come in, from money, from career, from training, everything. So you've got to be thinking on multiple factors at the same time. And I think the third thing that you mentioned very interesting was about training. I think that's very critical. Uh, Constantly, I think, like you mentioned, I go back to the technological advancement factor. How much we are keeping our doctors exposed. This is one sector again. There is so much of knowledge which is getting upgraded on a continuous basis. So our doctors getting upgraded becomes very important. At the same time, I think the rest of the team also, right from nursing to the support staff, their upgradation also becomes very important. There are some best practices that healthcare organization could be picking from, for example, from other sectors, on how you can actually groom your support staff to become maybe great nursing staff. The nursing staff maybe being extended some courses or something to become, I don't know, they could become doctors for all you know. So these are some thoughts, I would say, from a pure training, development, growth standpoint. So people have to think, and I think healthcare organizations need to keep looking at other sectors to pick up some of the best practices in all these areas that you mentioned.
So, that's very interesting that you said that, we should learn from each other and, pick up best practices from other organizations. So, and not just organizations, the good practices that are happening in different sectors, or if I take the healthcare ecosystem, there are institutions, there are medtech companies, there are diagnostic companies, and then there are providers. So do you think it's also a good idea to learn best practices, or collaborate with each other in terms of training or skilling or upskilling our staff, to move them up, to help them move up the career ladder? Do you think that is also a good thing? And are we actually doing this in our space?
I think that's a brilliant thought. And so while I was talking about, reaching out to other sectors for best practices, I think it will be very, very apt if the healthcare organizations really build their own feed off each other. I think that is very, very important, from experience sharing, knowledge sharing, uh, best practices sharing. I think that is where an organization like Nat Health can play a huge role in really creating those platforms. I mean, it will be really a delight if tomorrow an academy for medical professionals is started by founders of multiple healthcare organizations, where talent is actually groomed, developed, trained, and then everybody gets to hire from that academy, for example. I mean, I'm just again looking at some of the other sectors where simple practices like having a leadership academy has played a big role. So people have been having their own leadership academy rather than going to the IIMs of the world, and they have been designing their own courses and having their people grow in the whole process. I think here is an opportunity for the healthcare organization to really sit down and really think, can we collaborate more? What are the things that we can do together? I think it is important in today's context to understand that while we might all be competing, but I think the brilliance lies in how you can collaborate. And the more and more folks can do that, I think end of the day, the patients are going to benefit, because the best is going to be shared, exchanged, and you're going to really learn from each other. So I think there has to be a mindset of learning from one another, and not really giving a sense that, I know all, and so, we are the best. I don't think that could be the attitude that one carries. And like any other sector, honestly, the younger people, brighter people, more tech savvy, those are the people to learn from. So tomorrow, an established healthcare organization could be learning a lot from a startup organization which has done remarkably well on various things. So what are the things that they have done so differently, which an established organization probably missed out? So I think it is important to sit down together, and that is where federation like yours has a big role to play to get these players together, roundtables, seminars, sessions like these. More and more, I think conversations, dialogues are going to be really helpful so that everybody really grows together and we give the best to the patients and the employees, of course.
Yeah, I think that's the best way. You learn from each other because there are so many, everybody's an expert if you think it that way, and there are so many areas where you can learn from each other. So yeah, so collaborate with each other more is what, I'm taking from you. I'd also like to talk about, because we have been talking about, inclusive, um, having a workplace which is inclusive of everybody. There should be, there shouldn't be gender disparity. There should be diverse work culture. So how do you think, and I think most of the organizations are trying to take care of that, but, especially in healthcare sector and like any other sector, healthcare sector, I've also seen there are very few women leaders here. And there is, so how do you think in an organization like, you know, in this healthcare ecosystem, so there we should bring diversity and inclusivity in the workplace?
Yeah, so I think again, very, very pertinent question, and because one has been to hospital and has engaged with a diverse set of people, compared to my my corporate avatar, or even as an entrepreneur, there are certain set of organizations where you hardly see any diversity, largely in the manufacturing side. There also, I would say, at least gender diversity is growing. Other sort of diversity is also coming in. But I think healthcare organizations do start with a little advantage, and you see a fairly decent balance of diversity. But yes, at a leadership level, would you have many? I would say we are still okay compared to many other organizations, other sectors. But it's about also playing up and preparing the organization to promote diversity as much as possible. I think that has to be part of the HR strategy, which we were talking at the beginning, part of the hiring strategy, very important part of providing career path to employees in an organization where we are really promoting as much diverse candidates or talent as possible. So it definitely is a big talking point today. Are you seen as an employer who's very diversity, equity, inclusively oriented organization? I think for any founder today, it's absolutely top of the agenda again, that everybody wants to talk. And this is a very culture thing. I mean, I talked about the word culture. This comes from the top. It's about a philosophy. It's about a thought that the founders have, and they believe very strongly in it. And such places then thrive on diversity because they truly believe that this is important. And I think it again boils down to how the leadership is looking at this agenda. HR has a big role to play in influencing the leadership to push this agenda as much as possible. And I believe very strongly that given, like I said, there is little advantage in the healthcare sector where already gender diversity is at a pretty decent higher ratio. So one can just build on that, provide a very safe workplace for folks in the organization, digitize the workplace as much as possible, as many awareness programs that can be carried out. I think that becomes very, very important. So net, I think that again goes without saying that, the future workplace, increasingly, any sector are going to be talking a lot about diversity and inclusiveness and equity.
Hmm. So just to mention about this, in National Secretariat, we have more women, employees
Yes,
than.
I think, yes, that's a very good point. I can just count, I think about 7, 8 members. They're just about 2 gentlemen and of course one in admin, but rest all of you are all women. So that's again a clear case study of how diversity is a very strong factor there. Yeah, very much. Yeah, true.
So, I also want to bring your attention about, the changing regulations that are being brought for this particular sector. How do you think the founders and the CEOs can ensure compliance while still driving? There is innovation and there is growth, because there's so much innovation happening. And then the regulations comes a bit later, or sometimes the market is so much regulated that it's difficult to evolve. So what are your suggestions and thoughts on this area?
Again, I would go back to the discussion I was happening around culture. And for me, compliance again is a matter of culture. It's a matter of your principle. It's a matter of your values. It's a matter of your ethics. So one is what the government is telling me to do, right? And so then there are guidelines and policies, and so got to comply around it. The other thing is that if from a very common sense approach, if I think compliance, what are the things that I need to be mindful of, especially being in this business where a life and death is out there, and so patient is at the core of everything. So I think it becomes very important that if once we start thinking compliance from that angle, I think it becomes fairly simple. And so it it is absolutely imperative that you've got to have compliance 100%. I mean, you just can't be shortchanging, doing shortcuts in this type of business. And we have had disaster cases. I mean, where when things have happened, we have been found completely out of, things. Those are very basic to have been compliant. I think definitely compliance matter, but you ask me deep down, if I am a founder, I should be very clearly thinking, what are the things I'm going to be completely, there has to be a zero tolerance, there has to be 100% compliance, and we just don't have any room for any compromises. I think that is where the beauty. So globally, if you see healthcare companies, they really are very stringent. I think the kind of audits they do internally, I would say, I mean, they are, huge. Yesterday, I was at Dr. Reddy's labs. I was conducting a workshop, and a lovely word, that lovely phrase I picked up was called all-time readiness. Now, that all-time readiness is like the core. You can't be caught underprepared. So if on compliance, I think your all-time readiness is so very important because everything revolves around that. You just can't be caught non-compliant on even a minutest thing because this industry is so sensitive.
All-time readiness is one good, that is, I'll take from your suggestion. This is a very good thing, and I'm going to use it. All-time readiness. Now I want to shift the discussion to a very sensitive topic, and I think we should address that as well. There are two things that I would talk, that, the healthcare workers and entire the healthcare department, especially in the provider sector, they work under a lot of stress, and, we need to talk about mental health. One is, they are the patients, very critical, many times, very critical patients, compromising their personal life. So they are working in a very stressful environment. Second, there is always, with our lifestyle, there has been an increase in NCD disease burden. So that's another thing. Of course, we all are having a very stressful life, or probably we are not able to manage stress. And the third is there is also violence against doctors that we have seen, which makes it even more difficult for our healthcare professionals to perform, trying to save their lives. And sometimes, if something goes wrong, there also, violence is committed against them. So how do you think we should prepare ourselves, and how should we address this sort of challenge and keep our staff motivated enough to keep the work going?
Yeah, so, for any sector or industry or any domain that's up for a massive growth, there are pitfalls. And very clearly, the people who are joining this sector got to be mentally prepared that the pressures of growth is going to hit them. And like it's not only about the business side of things, but also from the patient side of things, the kind of number of footfalls that are happening, number of cases that are rising in all areas. So definitely when one is coming into this sector, you've got to be mentally prepared for it rather than getting hit by this whole stressful environment or so much of chaos, for example, at times. So I think for any medical professional joining this organization, this sector at this point of time, my strong recommendation would be right at the school stage, in the medical school, whether it is a coaching center, whatever it could be. I think preparing the talent there to be resilient is very important. It's important to also prepare them that at times we might commit mistakes, we might fail, and that can have very disastrous consequences. It can lead to a patient's death, for example. Now, that preparedness of a talent of a medical professional becomes very important. So that has to start not only in the organization where you have been hired, but you should have come prepared if you have been, kind of coached, mentored, counseled, and really prepared that this is where you are going to be working. And then, of course, on the top of it, whatever layering the organization does for such people and keeps conducting various counseling sessions. There are help centers, there are calls they can reach out to, therapists. I think a whole package of employee assistance programs, as they say, the EAP becomes very important in really providing full support and to the professionals who are working in these organizations, and which is again a very common practice now across. So when I'm saying, about medical professionals, I think mental well-being, the stress levels, it's happening everywhere. And people are looking for support. So where very progressive organizations are thinking much ahead of what they can do to really manage this situation. And so a constant connect, constant dialogue, constant conversations, sessions, experts coming and talking. I think those become very, very important. I think just having these listening champions, for example, in an organization. I'm part of a mental well-being platform called Happify You. Now, Happify You typically talks about managing stress, not only at a working professional level, but even at a student level and further down the line. So there are, things that are happening in this space which are very disturbing. And that's why for HR people, for the leadership of the organization, it becomes very important that you're creating a very safe place and also providing as many platforms and tools and folks to whom people can reach out. Tech today plays a big role in managing and helping people. I mean, you have apps now today where you can just go check how's your mood today and what are the things that I should be doing to up my mood. So I think there are multiple things that are happening in this space. And yes, again, boils down to clear kind of people practices that we want to have where, there is a basic mutual respect at the workplace. Things like violence at workplace, people being abusive, I think showing disrespect. I think those are things definitely go down far core to the values that the organizations have. So multiple things, multiple levels, things need to happen in this area again, because this is again one area of work where a lot needs to be done.
Mhm. So thank you, Rajneesh. I think I've tried to cover, we have tried to cover a lot many this limited time. And I think it's almost time that we should wrap up this session. Is there any, last comments that you would, or your words of wisdom that you would like to share with the people who have joined to hear you and, get insights from you?
So, it's about, I think, keeping a happy face of a patient is what should drive the business, and so that patient is your ambassador. He or she is going to talk about you, and the word of mouth today on social media travels rapidly. So your credibility is at stake, how you're handling a patient. I think the more we work around everything, HR, so many other practices, diagnosis, whatever you are doing, I think in this line of work, as long as we are keeping the patient at the center of everything, I think you can really bring more humane approach. You can simplify a lot of things. You can bring in a lot of care at the workplace. So which means that if I'm able to create happy workforce, naturally that happiness will get translated to a happy patient. That's what the end objective should be.
So patients are the ambassador indeed. And with those words of wisdom from Rajneesh, we would like to wrap up the session. Thank you so much, Rajneesh, for joining the session. It was great and very enriching experience personally for me, and I'm sure the people who have joined this would also love to hear you. And in case, if our viewers or whoever is listening, you have any questions, please feel free to drop in the questions in our comment section or on our social media platforms. We'll be happy to answer them. And till then, thank you all for joining. Thank you, everyone. Bye-bye.
Bye. Thank you very much, Anish. Thank you.